I'm sure we've all heard of Botox for its use in cosmetic procedures, but did you know that it can also be used for therapeutic purposes as well? So we learned the use of Botox in dentistry. It's gaining popularity. Check it out.
Dr. Kristen, first off, can you tell us what therapeutic Botox are?
Yes, therapeutic Botox is really more for pain management. When we think of Botox, a lot of times people think that it's more for aesthetics and relaxing the muscles of the forehead and, the wrinkle lines, but therapeutic Botox is more about pain management than anything.
Okay. And who would be a good candidate for therapeutic Botox?
Really anybody who's suffering from pain in the TMJ joint, muscles of the face, headaches, tension headaches, these muscles up here. If anybody has really tight muscles in their face, relaxing the muscles with the Botox therapy can be extremely beneficial.
So, when we hear Botox, like you mentioned, we think of it as a cosmetic procedure versus something that's going to manage pain.
For
and
sure.
You don't think to get it at a dental office. What is that process like at Polish Dental?
Yeah, so patients come in. For years, we've had patients who are having a hard time managing their TMJ pain and their headaches and muscles of the face. And Botox therapy has helped us so much because it's really just one more trick up our sleeve to manage that. We have occlusal splints that we make and different things that a lot of times we try in conjunction with Botox. But what Botox does is it's a protein that binds to the muscle and relaxes muscles. That's how it helps with aesthetics and wrinkles in your face. It relaxes the muscle to keep things flat and smooth. Well, people who are clenching and bruxing and using those muscles, overusing them, that protein binds to the muscle and can relax that muscle for up to 3 months. So women especially are notorious daytime clenchers, clenching all day long, more as a tool to combat stress than anything. But unless we're chewing food, our teeth really don't need to be touching. So if we think of that clenching all day long, we're really overusing those muscles. Well, how would your bicep muscle feel if you did bicep curls all day long? It's going to be big and bulky and on fire. That's how the masseter muscles in the face, if they're clenching all day long to combat stress, they're on fire essentially. So doing a little Botox therapy into that muscle to relax that muscle for potentially up to 3 months can be extremely beneficial.
Sure. And so is Botox something a patient needs to keep up with every couple of months?
In the beginning, it's ideal to do it approximately every 3 months. The Botox lasts for approximately 3 months and then it essentially wears away. Well, if we continue this and we try to keep up with it every 3 months, the idea is that we're trying to reprogram those muscles. Patients get more in a habit of clenching than anything. If we can relax those muscles for a 3-month period, those muscles kind of forget what they're supposed to be doing, and then we relax them for another 3 months. Over time, we're seeing that those muscles are forgetting that clenching habit, and so they just stay more relaxed for a longer period of time, or we could potentially break that habit so patients aren't doing that all day long ever.
Sure. And if someone comes in with pain, as you had said, how quickly would they see the relief after the injections?
That's a great question. The one thing with Botox therapy, it takes approximately 7 to 10 days to act on the muscle. So I tell patients, you're not going to leave with an immediate relief today. It'll take a couple weeks before you start to notice it. After a couple weeks though, they do start to notice, gosh, my headaches are getting better. The muscles of my face feel more relaxed, especially up in these temporalis muscles. These muscles up here work with the masseter muscles for that clenching motion. So a lot of people who are clenching all day also get tension headaches up here from overusing those muscles. So within a few weeks, they could potentially notice less stress on those muscles and possibly less headaches.
And thank you to Dr. Kristen. To learn more, you can check out Polish Dental by visiting their website at polishdental.net or give them a call at 701-222-4746.